Hello and welcome. Today we're diving into a fascinating, albeit somewhat alarming sounding, condition called black hairy tongue. Don't worry, it's usually harmless, but let's explore what it is, what causes it, and how to get rid of it. So, what exactly causes this unique condition? Well, black hairy tongue isn't actually caused by hair. The primary culprit is the overgrowth and elongation of filiform papillae on the tongue's surface. These papillae are normally small and regularly shed, but when their growth outpaces their shedding, they can become elongated, resembling tiny hairs. Several factors can contribute to this: poor oral hygiene, smoking, excessive coffee or tea consumption, dehydration, a soft food diet, the use of certain medications, particularly antibiotics, which can alter the normal bacteria in the mouth, and even radiation therapy to the head and neck. Now, let's break down the pathophysiology. The elongated filiform papillae create a rough surface which traps bacteria, yeast, food debris, and other substances. This accumulation leads to discoloration, typically black, but it can also be brown, yellow, or green, depending on the staining agents involved. The altered oral environment also favors the growth of chromogenic bacteria and fungi, which contribute to the dark coloration. The taste buds can also be affected, leading to altered taste sensations. Black hairy tongue is considered relatively common, though precise numbers are difficult to obtain as many cases are asymptomatic and go unreported. It affects individuals of all ages and genders, but it appears to be more prevalent in older adults, smokers, and those with poor oral hygiene. While the exact epidemiology is unknown, the condition is widespread globally and is not associated with any specific geographic region or ethnicity. The most obvious sign of black hairy tongue is, of course, the appearance of dark, elongated papillae on the tongue's surface. This is most often found on the dorsum, or top, of the tongue just in front of the circumvallate papillae. Beyond the visual appearance, some individuals may experience a metallic taste, altered taste sensation in general, bad breath, or a tickling or burning sensation on the tongue. In some cases, there are no symptoms at all, and the condition is discovered during a routine dental exam. Diagnosing black hairy tongue is usually straightforward and based on a visual examination of the tongue. A medical professional, like a dentist or doctor, can typically identify the condition by its characteristic appearance. Further diagnostic tests are generally not needed, but in rare cases a scraping may be taken to rule out other conditions, such as fungal infections or other tongue abnormalities. While black hairy tongue doesn't have distinct classifications or types, the color can vary depending on the causative factors. You might see black, brown, yellow, or even green discoloration. The key feature that defines the condition is the elongated, hair-like appearance of the papillae. Fortunately, black hairy tongue is usually a benign and self-limiting condition. The primary treatment involves improving oral hygiene. This includes brushing the tongue gently with a soft toothbrush or tongue scraper several times a day. Rinsing with an antimicrobial mouthwash can also help reduce bacteria and yeast. Addressing underlying causes, such as quitting smoking, modifying the diet, and discontinuing certain medications when possible, is crucial for long-term resolution. In some cases, a medical professional may recommend antifungal or antibacterial medications to address specific infections. Rarely, if conservative measures are ineffective, the elongated papillae can be surgically removed or treated with laser ablation. Preventing black hairy tongue largely relies on maintaining good oral hygiene habits. This means brushing your teeth at least twice a day, flossing daily, and using a tongue scraper regularly. Staying hydrated and avoiding excessive consumption of coffee, tea, or alcohol can also help. If you're taking antibiotics or other medications that may alter your oral environment, talk to your doctor about potential side effects and preventative measures. The prognosis for black hairy tongue is excellent. With proper oral hygiene and addressing underlying causes, the condition typically resolves within a few weeks. Recurrence is possible if predisposing factors persist. Research into black hairy tongue is limited, but ongoing studies focus on understanding the role of specific bacteria and fungi in its development and exploring more effective preventive and treatment strategies. Recent advances include the use of probiotic mouthwashes to restore a healthy oral microbiome. So, remember, while it might look alarming, black hairy tongue is usually harmless and easily treatable. Just keep those pearly whites and your tongue clean.